pretty simple. There's not a whole lot that's going to stick to it, other than unless it dries on there or something like that. So anytime you're handling the blade, you always want to kind of think it should always be closed. You take these guys and you insert them all the way up to the bottom of it, like into the dot right there. So diamond, dot, handle, those are kind of the components here. I want to hold it at an angle, and just however you're comfortable holding it. You go in, you make the incision, you just do like 5 passes back and forth, and then you rinse, and rinse, and you kind of look at it, make sure it's clean, close it, and it's ready for sterilization. Okay, so you see it makes a little slit in here. These trays should last you a fair amount of time. It's not a single-use cleaning system. If you notice that the pad is getting a little worn, so you'll see that little slit that's right there. You know, over the course of the day, this may start looking a little rough. So you can actually turn each one of these pads over and use the other side. One of the way to kind of preserve it is when you're not using it, keep the cover closed, and then maybe have a Ziploc bag to store it in, so that way, especially here in Nevada, right, just kind of make sure that the evaporation doesn't happen so fast. If that does happen and you start seeing a little bit of like the fluids kind of running out there, just add some distilled water to it, some sterile, distilled, critical kind of water, and fill it back up. It should be fine. The idea is that you're kind of just scrubbing off whatever things are on there. Okay, so there's 2 different types. This is a primary incision blade. You guys can see it's bigger than, well, it's this size. It's bigger than this guy, which is a secondary incision blade. This is much smaller. It's 1 millimeter. You really are not, when you do this, you're not really going to feel a whole lot, right? So you just go in, clean, rinse, rinse. Be very careful not to touch any of the plastic. That has the potential for damaging it. And then once you've cleaned it and you kind of hide it, make sure there's no kind of goop on there, put it back in the tray, and this guy can actually go into the full tray for sterilization.